Welcome to our new episode on Pentecost.
Why did Christ die himself?
Death. Because Jesus Christ conquered death, we too have a chance to live again.
What is the resurrection victory?
Christ of today is stronger than death. Death could not snatch him because he is the Son that could give life to whoever he wishes.
Explain the Pentecostal power.
The Lord appeared to give his disciples a mission to be agents for establishing the church.
And the deep significance of the resurrection and life.
The greatness of life lies in its being an attribute to God.
You can watch all of these deep subject matters being discussed and many more during the Holy 50s on the new show Pentecost with Father Mauritius Ambert Bishoy. Stay tuned on CYC.
Is coming. Here's my card.
3, 2, 1, action!
Welcome to the silver screen.
I really like the movie for more than one reason.
It's very easy for us to say, we demand change, someone change.
So I think everyone should know that C.S. Lewis, the person who wrote the book, is actually a Christian.
St. Paul identifies homosexuals, that these people will not see the kingdom of God. What does it mean to be fast to listen? The number of text messages that are sent each week has just passed 1 billion. Why is it that people in general find it difficult to forgive? How can we make our heart more sensitive to the Word of God, which is the seed? God forgives the sinners who repent of their sin. Welcome to a new edition of Soul Text.
CYC, Christian Youth Channel.
Hi, and welcome to another episode of Ask on CYC. So the day we find out that we're pregnant, our mums and mother-in-law's expertise all of a sudden falls into place. And without discrediting any mums or mother-in-laws, God bless them, they've endured us for many, many years, and I'm sure their expertise is a lot of help for us. But on the show tonight, we're giving you the opportunity to speak to an obstetrician who's delivered and has been part of thousands of births, and we're giving you the opportunity to send in your questions and speak to him on tonight's live show. So the phone number is 0416 551 292. You will never know the answer unless you ask. So please send us a text or give us a call and speak to the obstetrician on tonight's show. So I'd like to introduce you to Dr. Wagdy Nada. Welcome.
Thank you very much.
It's a pleasure having you on Ask.
Thank you very much.
So you're an obstetrician and a gynecologist. and you've also, you're a lecturer at the University of Sydney, is that correct?
Yes, yes.
So I want to get familiar. So what got you into this occupation?
Yeah, actually it started when I was in my undergraduate years and I was studying in the University of Alexandria, Egypt. And I liked the study of obstetrics and gynecology. And I was lucky enough at the time that the head of the department, we had his daughter in Egypt. If you have the head of the department, son or daughter in the same place, you get the best lecturers and the best people to educate you about things. And in fact, that's what happened. I mean, I was lucky enough to get the best people teaching us at the time with all the advances, what Alexandria University can get, and really every detail is answered. People are really keen to help you because you're one of the group of the elect at the time. So I had really good undergraduate teaching and training, and then of course after that it's very hard to get a post or study ONG in Egypt, for obvious reasons. So I continued, and straight away after I finished, actually, I was lucky to migrate to Australia, and then eventually I was again landed where I could find people just support and help, and I pushed me along with a lot of studying material and help, good references to work to move on to be a specialist.
Okay, all right. So let's start from the beginning. Husband and wife decide they want to have a baby. So what can they do to improve their chances of falling pregnant in the early stages of trying?
Look, in general, we say anyone's chance of getting pregnant, it's usually in the first. It doesn't happen like straight away. It sometimes take a year or even 2 years, and that's within normal limits, maximum 2 years. Of course, when the person is younger age, you can take your time a bit. We start investigating when people just become mid to late 30s, so you don't want to waste time and try to investigate. But in general, general advice about exercise, healthy diet, watching weight, avoid smoking and alcohol, and then what we call timed sexual intercourse. So when people are trying to get pregnant, if they have regular cycles, the best time to get pregnant or to achieve pregnancy would be, I usually say, discount the first day of the cycle, mark it on the calendar, day 10, day 12, day 14, day 16, which is the time where you can achieve ovulation. This is the best time to have intercourse. So out of the whole 28 cycle, the best time would be the 4 days in the middle. We get them to do that on a regular basis, and then after 3 to 6 months, if nothing happened, then we start investigating.
Sure. So I'm sure people who are trying to fall pregnant are doing regular checks on. But how about for a couple who are not regularly checking? How do they know what kind of symptoms shows them that they are pregnant?
It actually starts with the female. The female would probably if that was first time, she will ask, the immediate relative, would probably mum or mum-in-law or sister who've been through the pregnancy before. And symptoms like breast tenderness, morning sickness, switch off from some smells, and feeling sometimes moody. Things would change. It started to sort of feel uncomfortable, with certain positions. But the most common thing is morning sickness and breast tenderness.
Okay. And with the checks, so there's the pregnancy test that they can buy from their local pharmacy?
Yeah, it's easy, available. Once they miss the cycle, in general, people would know they missed the cycle, and they would just get one of these kits just in the pharmacy. They just buy it in, I think, $10, $12 or something, just to get it. It's a urine test, a drop, and we give you the answer within a few minutes.
And how about blood samples? Can that also show?
Yeah, I mean, now with the advances in science, most of the time either a urine test or is as good as picking up early pregnancy as blood tests. The blood test, we use it in a situation where we monitor the progress of the pregnancy, because give you a number, a hormone level, which you can monitor, and you can tell then the pregnancy going in the right direction or not.
All right. So the next question I'm about to ask you is probably the million-dollar question, and it's probably on a lot of people's minds. How do we rid of morning sickness?
Well, First of all, 7 out of 10 women would have, or pregnant patients will have, or pregnant females will have going through a morning sickness.
Why such a high number?
Very common. It's related to pregnancy. No one knows exactly why it happens. It's related to the hormones of pregnancy, but the exact mechanism no one knows, because it's actually the way we treat it is so broad, and not everybody requires intensive medical treatment. Simply by sometimes say avoid smells and food which you think would bring the morning sickness. Maybe start with a dry biscuit in the morning before you eat, something like a sugary lollipop or something like that. You put it in your mouth before. It has so many theories, maybe lack of sugar or hypoglycemia in the morning. Some other things we don't know why it happens. It ranges from a more mild symptoms, which most of it disappear by 12, 13 weeks, to severe symptoms of something called hyperemesis gravidarum, where a patient should be hospitalized for intravenous fluids, rehydration, and various strong medicines to stop the vomiting.
Okay. Just a reminder to our viewers, if you have any questions, this is your opportunity to ask an obstetrician a question. If you're planning to fall pregnant or you're in the stages of being pregnant, please, the phone number is 0416 551 to answer your question live on tonight's show. So how do they, so going back to the question, sorry, how do they get rid of the morning sickness? What advice can you give, or maybe just, handle it?
Majority of it's actually self-limiting, and a lot of people refuse to take anything for it, and they say, okay, I know I'm pregnant. The morning sickness will modify what they eat, the time of the day they start the eating or the meals. But things like vitamin B6, some antihistamines, which is safe in pregnancy, can be given. Things like the morning sickness tablets, it's over the counter. Try to hydrate yourself, like small frequent meals would help you to reduce the chances of things becoming really vomiting and kind of able to stomach thing. The problem is people sometimes say, I can't drink because it actually makes me try to vomit. So we give them, go around it by trying to have some ice to suck in the mouth, or some sugary thing to put in the mouth, and then go to the small bits. You don't have to drink a bottle, just small sips here and there, eventually until things improve. By lunchtime and late, things should improve, but sometimes the nausea can be all the day. But I said in the vast majority it's actually self-limiting, and you don't require. And I see a lot of patients, and we'd say, look, I'm okay. I just give them a prescription for something if they needed it, but by the time they're 12, 13 weeks, it disappears.
Okay. We just got a question from the audience. They're asking, the layer of mucus that forms in your throat and makes you sick, how do we get rid of that?
I mean, the mucus in the throat probably just means a dry mouth, a very dry mouth, and people are scared to drink, and because every time they drink, that will induce the feeling of sickness and vomiting. To get rid of it, it's just hydration by all means. As I said, sucking ice can sometimes help, or an ice block or something. That really put them. You don't have to really go and drink, because I said I can't drink. If you can't drink, you'll be dehydrated. And one of the indication of admission to hospitals actually is not lack of food, actually lack of fluids. So I usually stress the point to the patients in these situations, like if you can't drink or you can't stomach and you're having that sort of plug in your mouth and you can't take any more fluids, it's time to get to hospital for 12 or 24 hours hydration, intravenous hydration, revive and get back again to normal. So that mucus plug is usually dehydration, and the way is to combat that is just by fluids.
Okay. Another question that just came in from the audience member. They're asking, I'm currently taking an antidepressant and I'm 11 weeks pregnant. Is this harmful for the baby? Should I continue taking it?
You should not stop antidepressants without talking to your psychologist or the GP, because it helps in continuation of the pregnancy. So mother's health is very important to continue to have a healthy pregnancy. If the depression is too much, the mother can commit terrible things. So we do not stop antidepressant. If we can avoid in the first trimester, fine. But if we can't, we should not stop it, to get the minimal dose, and we continue through. and then the need to it according to the symptoms. So patients feel the importance about having a healthy feeling about the pregnancy is very important. So if you started feeling anxious, depressed, it doesn't help the continuation of pregnancy. So yes, it's by all means to continue, and with the guidance of the psychologist or the GP who's started the antidepressant.
Okay. Another question that's come in, how accurate is the time of delivery when scanning? Is it possible to deliver a give or take 2 weeks from the due date? And when can a delivery date be determined?
The accurate delivery day is determined by a regular cycle by the first day of the last period. So you're at 7 days and 9 months, they give you the expected date of confinement if you have a regular cycle. Most of the time now, most of us would do a dating ultrasound and to sort of match the period dates. The ultrasound and the period dates would usually within plus or minus 5 days, and the best ultrasound to date is somewhere between 7 weeks and 11 weeks gestation. So within that time, you would have made up your mind what is the expected date of confinement or the due date, and that is usually 40 weeks. So the date is given is actually the beginning of the 40 week. So you can get on top of that 5 to 7 days, a week on top, that would be finish the pregnancy, you go to the edge which is 41 weeks. So in general, a term pregnancy means between 37 completed weeks to 40 completed weeks. So that means in between that range, if pregnant patient required to be induced, that is a safe time to induce.
Okay. Another question that's come in, they're asking, I'm 11 weeks pregnant and due for a scan in a week. Should I be concerned that I left it for too long? Also, I'd like to add to that. So you recommend that they do 3 ultrasounds in the 40-week cycle?
It is not us recommending, it's actually the government. So the Medicare rules is it wouldn't pay more than 3 ultrasounds.
Okay.
We know that most of the time it's just only for it's economics. For them, they wouldn't pay more than that. So it's not really, the doctors will say don't do it. In fact, some ultrasound, I have a patient now who is pregnant and she's doing an ultrasound every 2 weeks simply because they need to be done as from 20 weeks. So there is certain situation, even sometimes do 3 times a week ultrasound for high-risk pregnancies. So when that happens, the public hospital usually would, or ultrasound in a public system would be able to cover most of these fees. So if getting away from the fees, what's recommended, usually recommended by the doctor, not necessarily what the Medicare would pay. So you don't really worry about what Medicare would pay as long as it's done the right thing by a patient. Then we can find a way of covering these items or the ultrasound scans. But it's not a rule to have only 3 ultrasounds.
Sure. So this audience member is asking, should I be concerned that they left it too long? So is it necessary to leave it for that long?
No, I think you're talking about the Down syndrome screening, which is done between 11 and 13 weeks, which is what probably the caller is asking about. The 11 weeks ultrasound is now getting to sort of an old-fashioned thing. So the new technology has allowed us now to know the chances of Down syndrome from a blood test called NIPT, or non-invasive perinatal testing. And there's few labs who do this in Australia. It started in America, and here in Australia it was actually $2,500 just a year and a half ago. Now it's dropped about for $50.
When can this test be done?
Done any time after 10 weeks. It's more accurate simply because it actually detects fetal DNA in the blood. So that's really a very high technological advance to try to get the baby cells coming from the fetus to detect in the mother, just a simple blood test. And they can tell through diagnosis, through the DNA analysis, the abnormalities which they're looking for, which is the Down syndrome and the other less common abnormalities, plus the fetal sex. I mean, you can now know the fetal sex even from 10 weeks.
Okay.
So that is actually more or less, I would say, almost replaced the NT scan, which is a nuchal scan, which is talking about with 11 weeks. So it used to be 11 to 13 weeks. The thing with the NT scan is actually less accurate in diagnosing the Down syndrome. Give you about 86-87% accuracy with what's called 5% false positive. So I mean, you can, in every test you do, there's a 5% chance that there is a baby is telling you that there is a Down syndrome, but while it's not, then you have to go for an invasive test to diagnose it. While this new technology has allowed to give you a 99% accuracy with regards to the Down syndrome screening.
Okay. So for the concerned mothers out there who don't want to be restricted to 3 ultrasounds, they can go for as many as they want.
Absolutely. I mean, it's not the mother's choice to do it. In fact, it will be guided by the obstetrician or the caring doctor.
Sure.
So, I mean, you sometimes have moms who ask you for an ultrasound and ask them why. I just want to have a look at the 3D baby.
Okay.
Yes, it is. So that means, yes, I mean, if it is, but it's when the doctor say, look, you need to have an ultrasound,
sure.
There is no limit.
Okay.
Either, you know, 2, in general, will be 2 or 3. So a dating scan, a 19 weeks ultrasound scan, which is the ultrasound pregnancy, which is midwife, and then 3rd trimester ultrasound scan may be required.
Sure. All right. We actually got a lot of questions coming from the audience, which is great, and I love to see that because this show is for them.
All right.
So, another question that's just come in, what are the signs of a potential miscarriage?
It starts with, I mean, 2 things, either bleeding, spotting, and I have to be careful about here because there's a lot of, early in the pregnancy you may have some spotting, and that's what called implantation bleeding. So when the little sac implants inside the uterus, it actually can, it gets into a cushion, some tissue full of blood. When the little sac sits in there, it actually can pierces this sort of sac and then start bleeding. But you may get some bleeding. 7, 8 weeks, you get spotting. It could or could not be miscarriage. So the first sign usually is a bleeding. So that will create some alarm. And the only way to know until 12, 13 weeks is an ultrasound. So an ultrasound quickly can be done. Most of obstetricians have the ultrasound in the rooms. You quickly, or your GP would send for an ultrasound. Most of them will fit in an urgent one just to assure the mom that everything is fine. Otherwise, later in pregnancy, the time between, say, the 10, 13 weeks to the 19 weeks when there's no fetal movements, no one can feel anything at all. Moms sometimes get anxious about reducing the symptoms of pregnancy. So if they, you know, I have no longer, especially in, you know, the end of the 1st trimester toward the end, the 2nd trimester, people would think sometimes, you know, the breast tenderness disappeared. I don't feel that I'm pregnant anymore. That feeling pregnancy is gone. It may or may not give you that something is going on. So in general, ultrasound would assure.
How common is miscarriages for first-time mothers?
It has nothing to do with first time or second time. It's actually very common. So it's about 30-40% chance. So every 100, you know, pregnant patient, mom would have 30-40% of them would miscarry, and this is most of the time due to accidents of nature. So it's not all the time you have the ultimate and the optimal environment to get. It's very complex to get a sperm into an egg and to create a human being. Any small deficiency on any chemical can change the whole thing and becomes an abnormal baby and the you know, thankfully, you know, the body would detect that early, and we have an early miscarriage. And I usually say when moms have the miscarriage, thank God it happened early rather than we have late. We have to wait for this result of tests like that, and you know, get the baby is an abnormal, stays longer, and it's more problematic. So the early miscarriage it's merciful because baby was not right and it's not meant to continue. And I would say most of the time you get a second one, should be okay, but it is very common.
Okay. Yeah. So another question that's just come in is it true a woman should wait 6 months after taking her last pill before trying to conceive?
Not really. In fact, the pill has few advantages. One advantage is actually regulate the hormones and regulate the cycle. In certain situations, we prescribe the pill for 3 months to regulate the hormones and stop the pill, you get pregnant straight away. So there is no scientific reason whatsoever to wait after the pill, because the pill is actually doesn't affect anything at all. So once you stop the pill, there's no effects afterwards. You can get pregnant. People can get pregnant straight away after you stop the pill, and a lot of people will get pregnant on the pill if they miss the pill, and there's no problems with that. There's no known problem occurs when someone got pregnant on the pill. It's very common.
Okay. Another question that just come in. I just found that I'm pregnant. When should I book to see an obstetrician?
Usually about 7 to 8 weeks. In general, we say the ultrasound, they will do a dating ultrasound, or the GP would send for a dating ultrasound to come. The dating ultrasound is very important especially if you don't know exactly or you're not sure about the first day of your last menstrual period.
All right. Another question that's just come in there asking, I have a really bad dry cough. Can I take anything for this while being pregnant?
Yes, most of the time, a codeine type of medicine would help, as long as both will probably has to be checked first by the attending GP. Listen to the chest. There lots of time there's pneumonias out there. Remember that the immune system drops with pregnancy quite easily, so you can pick up in pneumonias, whooping cough around. So things like that, just the GP would have to look into it. But as simple as Panadine, which has Panadol and codeine in it, can help the dry cough.
Sure. Another audience question: is there any negatives with the care and services of public hospitals?
From where I start. Look, the public hospitals, they're trying hard. I mean, I'm part of a public hospital, and I understand really the challenges with the public system. The public system they're trying to be as much as they can safe and efficient, but the numbers are, a lot, and the staffing is still struggle. The beds are struggle. So there is challenges, of course. No one would like to harm anybody. No one intentionally harm anyone, but becomes really busy, and the number of cases going through from unbooked you don't know things about, and everything land on the public system makes the system very, very difficult to manage, and the funds usually, the sky is the limit. So as far as personnel, staff, doctors, not at all. We find the best people are employed by the public system, but the challenge is just the funding.
Okay. Sorry. Next audience question is there anything that can be done to make my labor quicker and less painful?
There are limits. I think induction of labor, if we're going to do induction of labor, means start labor artificially before spontaneous starting of labor. Makes it quicker, and with the use of epidural will make it less painful. Most of the time we try to conduct labor these days this way. Not everybody is induced, but when you come in labor, assessed, and then we try to make the mother in the most comfortable position. You offer so many things. Pain almost. It is the most pain relief you can get with labor.
Okay.
Best.
So epidural is a very hot topic, but we're going to go for a quick break, and when we come back, I want to discuss more on the epidural. So just a reminder to our audience members, the phone number is 0416 551 292. Please, this is your opportunity to ask questions, and you get the answers on tonight's show live. Send us your questions or give us a call and speak to Dr. Wagdy Nada on tonight's show. Thank you.
الشخص الروحي يشعر أن حياته ملك للناس. وربنا أعطاه هذه الحياة لخدمة الناس ولإسعاد الناس.
Atheism. We are using scientific facts. We have many proofs. Atheist scientists converted and became believers. Watch us on CYC Coptic Youth Channel.
bold all things to all men.
Every evangelist is unique. Every recipient of evangelism is unique.
Building community with relationship builders.
How am I going to hear the Holy Spirit? Is it easy to hear the promptings of the Holy Spirit?
One-time messages.
Pray harder. Listen harder.
Series of sermons by Father Anthony Masiha.
And I'm just making it easy and say, just hear the Holy Spirit, and that's it.
From St. Timothy and St. Athanasius Church in Arlington.
Man, it's hard stuff, but we need to strive harder. Jesus loves to leave behind the 99 and go after it.
CYC, Christian Youth Channel.
Hi, and welcome back to Ask on CYC, where the topic tonight is what to expect when you're expecting. So we're giving you an opportunity to ask an obstetrician a question. Please, the phone number is 0416 551 292. You never know the answer until you ask, so please send us your questions. So, Dr. Wagdy, before we went on break, because a lot of people are worried, is it safe or not safe? Is there side effects, and do you recommend it?
Okay, safety is always a relative. When I ask about safety in anything, I say, look, we drive cars every day, and the chance of anybody of us, have a serious car accident is somewhere between 10 to 20%. That's on daily basis, and there's so many accidents can occur. Epidural in itself, I would never say something is 100% safe, because always there's small risk of nasty effects. And for example, the worst effect of that, something damage of nerves or whatever, probably 1 in 3,000, 1 in 5,000, which is rarely happen these days, or permanent injury from epidural is very, very rare these days. Infection, this is the worst things you can have from epidural. Otherwise, some normal, side effects from it when you have it is, some blood pressure drops, and it's usually looked at when they put the epidural. Shivers, temperature changes, which is common when due to the block of the nerves where they're injecting the medication. But it provides a very stable, long, safe for baby pain relief. It's actually can be adjusted. The woman would have a line set next to her, and we can top up every hour or two, depends. Labor can last for 8, 10, 12 hours. It's not only provide pain relief, but you can use it for instrument delivery. So toward the end, if a mum required a forceps or a vacuum delivery, again, mum, all what she needs to push, and the obstetrician would help to pull. Or if she required a cesarean section, she would still be awake. Husband or the partner would be next to her when doing the C-section. So it's sort of a package. I'm all for it because it gives you that sort of stable, in control. People, you never see someone really happy and smiling and pushing at the same time if they have the pain. Usually the last bit of the labor is the most painful and intense. Some people would like to go through it, not for everybody. People would say, look, I can take it. And, I would say out of every 100, I would have maybe 5, 6 patients would like to go without, and okay, that's fine. So as long as you can take the pain, by all means. But sometimes when we have to do something more than the natural birth, and you need to do it quickly, then epidural would help. Long ago, I had someone which have the placenta stayed behind after the baby's delivered. Normally, if she has an epidural, and it was not really far away, not really inside the uterus by much, but every time I tried to examine and try to pull, it's a lot of pain, so we had to take her. She did not have an epidural. We had to go for general anesthetic, so prolong the situation. In general, it helps, but I said not for everyone, and there's other methods of using. People have short labors. Sometimes you don't want to have an epidural because some people just, 2 or 3 hours labor. Sometimes they're really good. They don't want to.
Can anyone request it, or is it only provided?
Everybody is only small situations. It's a number of cases which is not permitted medically. if someone have, you know, problems with hypertension, low platelet count, things like that, will have to be checked before the epidural. And it's usually, the service is 24/7, and every birthing unit in the state, private and public, have it. And in the private hospitals, usually the anesthetist does it. In the public hospital, the trainee specialist does it.
Sure. So can anyone, before the birth, can they just say, I want a pain-free birth, I want the epidural, and request it, even if there's nothing pushing for it?
No, nothing as such as pain-free birth. We have to tell patients that pain is natural, is normal with labor, pain. But I mean, that's God's design, that we can't have babies without pain. So it is a natural process, not really a it's too late, then mom would not be in the right position to put it in. It takes about 10-15 minutes to put it in. Mom would have to be stable and, you know, ready to have it. But otherwise, yes, it's actually when the pain is there and it's okay by the caring team, the obstetrician, the team, then yeah, you can ask for it.
Okay, we just got a few questions that came in from the audience. First question, they're asking, can I carry out with the house duties and professional work while being pregnant?
Absolutely, yeah. I mean, there's certain things you should be careful about, you know, always the domestic, I mean, there are always some accidents in the home, and I had not long ago a patient who had burn in her tummy when she was standing doing something in the oven, and people sometimes tend not to, because it's not common to have something bulging out and she pushing something towards her and she had a burn. So things like a normal duty, as long as you just be careful about what you do, just continue doing your work, professional office work. You know, in general, we don't stop work unless there is medical indication for it. It's healthy to work, to continue to work, to mix normally with your colleagues until there is a time we say, no, it's not proper, or there's some contraindication, we need you to be hospitalized or to stay home due to various reasons. We recommend that. Not very common.
How careful should a mother be in her first trimester?
I would think just live life normally. There is nothing.
No heavy lifting, no.
It's not about heavy lifting. People think just have the heavy lifting about the back. In fact, the heavy lifting, they think that with the heavy lift they drop a baby. I think it's a myth. In general, once you're pregnant, you have a hormone called the relaxin, and relaxin hormone just relaxes your body ligaments and muscles, and especially the back muscles. Lifting things can hurt your back, and especially after having baby toward the end, pushing legs up, the back muscles become. So people most of the time have back pain, and in fact, the saying when literature would say 1 in 3 women will have back pain, no matter what, had an epidural or not have an epidural. So back is very, very commonly injured. And or what you need careful about, footwear. In general, exercise is important. Walking 3 times, 4 times a week is good. Classes, attending classes, physiotherapy classes, or pregnancy-related classes for exercise is important to strengthen your back. But exercise should not stop. Carry on what you're doing. Don't start new exercise you're not familiar with, but continue with what you're doing. So just be careful and do whatever you like to do.
Yeah, okay, that's very interesting. You said that. Actually, recently I follow a lot of fitness pages on Instagram and Facebook, and I saw a woman who's pregnant, she was in her final days, and she was training CrossFit style training. How dangerous can that be, though?
Look, this is not for everyone. And there was a few years ago, there was a case to court, someone who was a netballer, and I think the team coach has banned her from doing, because it's a contact sport, and they worry about if she fell, will have trouble. She actually took them to court and she won. She continued, and she was 32 weeks pregnant.
Oh, wow.
So, look, some people would continue as long as you know what you're doing, balance. Of course, she would have been very good in balancing, and she knows what she can do. But, in general, exercise under the care of, lots of fitness places now provide classes fitness classes for pregnant women, and it's very healthy. Improve your balance and good for the muscles and exercise and your weight as well.
Okay, so you would recommend that?
Absolutely.
Would that help with labour if you're fitness is high?
Yes, I mean, if you're fit, and actually labor itself, as I said, like in general, labor will take about 8 to 12 hours for a first baby, and sometimes with the last stage of pregnancy, and you're pushing, pushing will take about an hour or so. So every 2 or 3 minutes, there's a push and continuous push for a minute or so. It takes a lot. So if you're not fit, sometimes it's very, very difficult. So going through the whole pregnancy with an exercise regime and walking and improve your breathing would help a lot in achieving natural birth. Yeah.
Sure. All right. So the next question that just come in, they're asking, I always feel like eating fast food and other takeaway food is bad for the baby. Can I also add to this question? Let's talk about diet. Please answer the question, but also what is not recommended for pregnant mothers to eat?
Okay, the problem with fast food and junk food is actually a lot of fat and a lot of carbohydrates, and the oils they use as well in this are not healthy at all. So we try to avoid the fat content. We'd like to avoid the high sugar content, which is most of the time in the junk food. Because there are conditions like gestational diabetes are common in pregnancy, and we screen every pregnant patient for the gestational diabetes at 26 weeks, and sometimes we have family history, we scan it early, because we don't want the mother to put on a weight and which can affect the baby and develop diabetes, which can have consequences. So junk food, for obvious reasons, is not healthy. It's not healthy for the normal person. It should not be healthy for a pregnant patient. You can eat, so many things. You can add chicken, proteins, whatever, chicken, meat, fish, canned fish. You can have crackers, rice crackers. You can have so many things. You can have fruit, all sort of fruits, as long as you reduce the bananas, the things which are really high sugary. But I mean, there's so many things available now as a sort of a healthy diet. Again, fizzy drinks and high sugary, Cokes and stuff like that, and energy drinks avoided. We prefer plain water. It's still a bit more boring, but it is the best thing. So it is. So diet in general, it is the things which are healthy for the normal person should be the way to go with the pregnant patient. The no-nos are the big no-nos are drinks. We say try not to drink too much coffee, maybe one a day if possible. That's fine. No alcohol at all, and try to avoid the things with which I usually tell my patient to do. Avoid uncooked fish or sort of meat. The kabbe, nausea, the stuff the Lebanese do, all these things which is, avoid it, because you never know what happens. And I would say, again, salads outside, open buffets, you find kids actually going with the thongs, having, people holding things with it can attract infection. Again, the immune system is low in pregnancy, so you have to be careful. But, salads at home, you can do whatever you like. Canned tunas and stuff like that is excellent.
Okay, so how about fasikh?
Big no. Look, it's for two reasons: the way they do it and the very high salt in it. So we don't knock too much salt. Of course, it's not really healthy. It can tip the balance for hypertension. We don't want that. Things like the way they process it is not the best way. And I mean, you see every time there's a fasikh festive, you find people going with diarrhea and admission to hospitals, and it can kill people. It depends on how they do it. So I think it's not to take that lightly. I know people sometimes would like to taste. If you want to taste it, taste away when you're not pregnant.
Okay, very interesting. A lot of people are watching the show and like, no, why?
A lot of mums and dads are not going to be happy with it. But again, I'm not saying fasikh is not bad. Not long ago, I had fasikh with some friends, and I enjoyed it, but it's just, it is, when you're pregnant, you have to be very careful.
Okay, I know you mentioned earlier alcohol. So not even a glass of red wine is prohibited completely?
Now, the recommendation from the 3 major colleges in the world, which is probably the American College of Obstetrician Gynecologists, the British College of Obstetrician Gynecologists, and the Australian College of Obstetrician Gynecologists, none of them would recommend alcohol because there is no safe limit. So it's your responsibility. So we do not recommend alcohol. There used to be 1 glass, but we don't know. This safe limit for alcohol is not known, and not a study will allow ethically to give people alcohol and to measure the safety of it. So it is no.
Okay.
It doesn't mean if you had alcohol early in pregnancy it would affect you. So as long, a lot of people will have in the first 4 or 5 weeks a lot of things, and I get asked that question so many times about, you know, I had antibiotics, I had this medication, I had, you know, I was out and we're on holiday and we had alcohol. Most of the time, the early fetus is quite strong. It's either the all or none. So it wouldn't, in general, wouldn't affect the baby. If it wouldn't affect the baby would be fine. If it affected the baby would miscarried. So I wouldn't be worried much about. That's a general advice.
Sure.
Even
Okay.
X-rays sometimes early in the pregnancy, we don't really.
So to be safe, better no.
Absolutely.
Okay. I actually got a question that come in. It's actually more of a gynecological question. So the audience, they're actually stating that this is a gynecological question, related question. So does using a tampon make me not a virgin?
No, not really, because the hymen is most of the time it can stretch, and you know, not everyone with the first intercourse would bleed, and this is, you know, the statistics would say there's about maybe 30% chance that may never happen, and people were just, you know, thinking that, you know, when I see some blood, it's, you know, that means it's virgin, and you know, blood can occur even in someone who had intercourse a few times if this is rough enough. So no, for people who want to use tampons, it's a small thing you can use, and as long as you remember to take it out, because I had some people who actually forgot to take it out and it was a bit of a trouble. So for the younger people who were using the tampons, it's fine. In certain situation, it is okay, but it wouldn't harm the hymen.
Hymen, okay. Another question that's coming from the audience, they're asking, a lot of women these days try to avoid breastfeeding. How important is breastfeeding?
Look, if we're talking about the best, I would say the best would be breastfeeding, and the second best would be formula feeding. Because, again, if you have an easily available source of food with all the beauties comes with it, the immunity and protein, and readily available, sterile, you can do it anytime. The ease of it, it's fantastic. So, but I usually tell my patients, don't really be stressed about, because sometimes it is very challenging. You can get infections, you get breast abscess, you can get so many things. People who are keen to continue, there's ways around it. People who cannot continue with it will say, okay, it's too much stress for you, better concentrate on, move on, better concentrate on how the baby would just, you care for the baby, there's so many other things, and formula feeding would be the second best.
Sure.
I would normally push, like the same way I was natural birth versus cesarean section, for example, I would you know, push for as, you know, natural as it is. So God has created us to have baby naturally, then we go for natural birth. The second best would be a C-section. But I mean, some people would say that C-section is the best thing because it's elective, it's whatever. Then we have to have a chat about it. The same with breastfeeding. If you can do it and it's done nicely and safely without too much stress, this is the best way.
Okay. Another question that just come in from the audience, they're asking, can I have a physical relationship with my husband during pregnancy?
Yes, as long as there's no bleeding and as long as no water leakage, or the doctor didn't specifically say don't have intercourse for reasons such as previous history of premature labor or placenta sitting down where the baby will come out. So certain indications the obstetrician would say don't do it until we tell you, and otherwise if you haven't heard anything otherwise, live your life normally.
Okay. I just want to ask, so for people out there who are, you know, just about to enter those first few stages, so what should they expect from an obstetrician?
People coming for the first time?
Yeah.
Normally, usually the first visit to see, when you see the obstetrician, actually it's the longest. It usually takes about, you know, 3/4 of an hour. Simply going through a history taking, so you know exactly where we're starting. What's the previous history like? There's any contraindication of certain things? What's the medical condition of the patient? What is her general health like? What's the gynecological problems she had in the past? Pap smear, breast checking, all sort of things to be checked. Is it the first baby? You got a detailed history of how many children she had in the past, any problems associated with previous pregnancies. So it's so much there. And then you can, in general, we give the patients usually what's called the antenatal card, which it's filled out and given to the patient. So the patient, the only time the patient would probably walk around, a young person go around with her medical record when she's pregnant, because she cares for herself and the baby. So all the investigations are done, it's written there. So after we go through the history taking and identifying specific risks, if there are anything, then you go for the examination and do an ultrasound in the rooms and check it out, check the baby, and that would be the fun part of it. And then carry on after that for investigations to be ordered, if it hasn't been ordered, blood tests in general, and urine tests, and talk about, things as we talked about, pain relief in labor, blood tests to be done for Down syndrome and prenatal testing, normal symptoms in pregnancy, and there's so many things. And I usually provide the patient with a pamphlet or booklet with all sort of things, and then usually the antenatal care comes in sort of every few weeks. So every week we will have some questions to be asked, and we answer these questions. So it's so much there in that first visit, and people will just filter the information through, and then they come back again. I mean, I don't mind coming the questions again if they miss anything. But that first one is very, very important, because sometimes you need to divert the sort of the attention to specific risks, and you work on it to fix it before it becomes too late in pregnancy.
All right. Sorry. I just want to go back and talk about the mother being cautious. So being a passive smoker with a husband is a smoker, or if her friends are smokers, how dangerous is that for the baby? It's very risky. It's as risky as smoking. So that's why in a lot of public places now it is deemed inappropriate, and you can't actually have smoking in buses, and even the school ground, the hospital grounds now, you actually have to be somewhere out in a designated area, and a lot of places now at work. Passive smoking as risky as smoking, and especially with pregnant patients. There has been studies performed on passive smoking, give you risks of miscarriage, risk of stillbirth, risk of ectopic pregnancy, developmental delays in babies. So it's an absolute nightmare. So in general, if someone, and then we tell, say the husband who's the wife is pregnant, the husband is a smoker, everybody knows now. They go out in the balcony somewhere and stay away from the house environment, because it is not healthy at all for the developing fetus. Okay, so let's talk about getting closer towards the delivery. How can a husband and wife prepare themselves for the delivery? It's a good question. In general, we recommend, once the patient is booked into the hospital where she's going to deliver the baby, there is something called the antenatal classes. So we ask the patient to book these antenatal classes. It's important in getting a lot of couples together and talk about starting from labor ward. They get them a tour. They talk about pain relief in labor. They give them some videos to watch about what different types of labor delivery by C-section or natural birth. What is the pain relief like? What's the options available? Not only importantly, after that, with breastfeeding, caring for the baby, changing the baby. So and usually it's the good thing about it. Actually, the husband and the wife is there, and it's a sort of on a long, it's a day, full day with or a Saturday or something, run by trained midwives in this, and it's fantastic. I mean, I would recommend that sort of antenatal classes, especially for the first-time moms. Okay, I have time for one more question, and as much as I want to keep going, very interesting topic. And the actual question that I'm going to ask is actually an audience question, and I left it to last because it's a good way to wrap up tonight's show. The audience member is asking, do you see God's hand working in your line of work? Absolutely. Every day, every minute. It's one of the things that keep me close to God, this specialty. The beauty of birth itself, the miraculous way of you're seeing through from start, the people we just, sometimes we pray for patients when they come anxious about not having babies for some time, delayed fertility and issues, going through different surgeries to help them out to do things, going to the delivery of the baby, second, third baby. It is always God's hand. You can see it, because without God's hands, in fact, we can't be here. So I see it every day. I see it every minute. A little prayer before we start, it makes a lot of difference. And yeah, it is something I see it every day. It actually makes me sort of put more faith in me. The more
you find things which is sometimes say that's hard, it's not going to happen. And, you know, praying, and you find that, you know, it happens.
Wow.
It is, yeah.
All right. I'd like to thank you very much for
My
a very insightful show.
Pleasure.
And I'm sure the audience benefits so much from it.
Thank you very much.
Thank you, Doctor.
Thank you.
And thank you to our audience members who've tuned in tonight. And thank you for all the questions that you've sent through. Remember, you'll never know the answer unless you ask. Almina Ibrahim from your CYC studios in Sydney, good night and God bless.
Lovely wife to be on top and successful?
They have to come to terms with each other and how to handle the money issue.
Just say the truth. You don't like my family.
I don't even know why I stay with you. You're so obnoxious.
I'm leaving. Bye.
Jealous.
Try to analyze the perspectives of each of these couples.
Thank you for joining us and welcome to a brand new season of 4 Couples Only.
Is coming. Here's my card.
3, 2, 1, action!
Welcome to the silver screen.
I really like the movie for more than one reason.
It's very easy for us to say, we demand change, someone change.
I think everyone should know that C.S. Lewis, the person who wrote the book, is actually a Christian.